name is Morgan Patterson, and I'm going to talk to you today about the importance of having a child life specialist in not only hospitals that specialize and have pediatric units, but also ones that don't specialize in the area of children. People have many fears that they deal with on a daily basis and in the world today in their everyday life. Some people are afraid of the dark because they're afraid of what could be lurking in the dark with them. People are also afraid of storms because of the nature, confusing nature of a storm, because they're unsure of what could possibly come out of that storm. Richard Ames states in his article, Facing Fears, that the key to facing your fears and conquering them is to know the future and to be ready for it. When a child enters a hospital, their future is questionable. The child doesn't particularly know what exactly is going on in their body or what could possibly be their future, if they even have a future. And sometimes it's very difficult going in there, especially kids with life-threatening illnesses. Seattle Children's Hospital sees about 351,147 patients annually. Out of those patients, 591 come for asthma, which is a very difficult thing that causes anxiety, because you're unsure and confused as to if you're going to get the next breath or what's going to happen. And chemotherapy sends about 582 patients to Seattle Hospital a year. Children are unsure of their health, and I can't imagine how being in a hospital and having to go through chemotherapy treatments but not being really exactly sure why you're having to do those treatments and what's wrong with your body is a very difficult thing, and I can't imagine having to do that, especially at a young age. The job of a child life specialist, according to the Child Life Council, is to help children and their families overcome life's most challenging events. The role of a child life specialist in a pediatric unit is to do things that take away from the anxiety and stress and worry of being in the hospital and turning everything that could possibly become a fear and turn it into something fun and that you're aware of, not exactly fun, but something that you're aware of, and it's easier for you to cope with or the child to cope with whatever it is. They do plays, they put on little programs to explain the different reasons why they are having to take these tests or do these procedures, and they use dolls and explain, even themselves explain, this is a mask, and this is why you're wearing this mask, and this is what the mask is going to help, and this is to keep you from getting any germs, or this, we're taking your blood to test and see, different things like that, so that they explain to them, this is why this is happening. Not only do child life specialists and pediatric units deal with the patients themselves, but they also deal with the family members. And this is very important because sometimes family members being stressed and the attitudes of the family members can affect the patient. And also sometimes we forget about and worry of the patients. The parents sometimes forget about the other siblings, and so the child life specialist spends time with the siblings of the patient to explain to the sibling what is going on with their brother or sister, and to explain and to deal with the grief and all of this stuff, and possibly explaining to their sibling that they might not be able to go outside and play ever again, and to help the sibling be able to cope with that. As many people learn about this career path, they begin to go to school for it and stuff, but then they realize that sometimes there's not as many job openings in the hospitals and stuff for them, to find a job. So many are found without a job, but it's a very growing career path and very exciting career path, especially for people who want to help kids but aren't sure that nursing or in the medical field is something that they would be interested in. unfortunately, the problem with the reason for this, for the lack of job openings, is because many hospitals think that there's not a point in having a child life specialist if they don't have a pediatric unit. I disagree with this because I believe that that children that are in the hospital that come in, and even though they're not in a hospital with a pediatric unit because their illness isn't like certain places won't don't bother with, I don't know. But with that being said, I feel that it's very important that someone be there to take care of those children that are in the hospitals in areas where the child life or children are not the main focus. And because I remember when I was in second grade being in the hospital and having having breathing treatments or having different things like them coming to take my blood, and I wasn't sure why they were doing this and why they were waking me up at 3 o'clock in the morning to give me breathing treatments, and I didn't know what was going on, and I was scared to death, and nobody was there to explain it to me. So that's why I feel it's very important that a child life specialist not only be in an area or in a hospital that specializes in children, but also hospitals that